What's up, everybody? Welcome to another Kinstretch class brought to you by Stretch Effect. My name is Coach Luke, and I'll be taking you through this 25-minute knee and toe focused Kinstretch class. So the majority of the class will be focused on knee rotation as we get just the work of the tibia internal rotation, and then we'll work some knee flexion as well, and then we will just sprinkle in some toes. We'll do our toe cars in the beginning, and then most likely at the end as well, if time allows. So we get right into our knee cars. So the knee cars, we have our kneecaps and our knee rotation. So we're going to start with the kneecaps. Kneecaps tend not to get enough attention with our cars, especially in the classic videos. You can give them the same position, kind of figure four. I will do it from just a half moon position, just so you can kind of get a better view of what we'll look like here. So you could do it from here, you can do it from standing. You want to make sure the leg isn't locked out and squeezing, so the leg can be straight, but we want to make sure that knee is relaxed. So if you can kind of see here, I have a grip on the patella, right? The kneecap. You can grab from 4 fingers, you can grab all 10. You just want to get the leg relaxed so the kneecap can move. Start moving it up and down. That'd be kind of weird, it's the first time you're doing it. And we're going to go side to side. So just like our shoulder blade, how the shoulder blade's kind of suspended and it needs to be able to move 360 degrees. Same thing for the kneecap. Kneecap usually can move up and down for most people. A lot of times side to side doesn't work. So we just want to make sure that we can get all 360 degrees of motion. So we've got 4 fingers, 10 fingers, go down, come in, up, out, and down. Again, it's the first time doing it. If you're new to this type of work, may feel kind of funky, may feel kind of weird. That's okay. And come back around, we're going counterclockwise. Let's just do 3 rotations. All around. And switch. This leg's down, this leg comes straight, relax that leg, okay, make sure the leg's not, if you lock out your squeezing, you won't be able to move that kneecap, so make sure you move the kneecap, start moving it up and down, just go a little exploration, move up and down, side to side, make sure you move side to side, move from there, down, and around. Go 3 counterclockwise, and 3 clockwise. Identify if it doesn't move well in one direction, that's just a little expensive time. If it doesn't move in very well, you can just hold it and just push it in. The more time it spends there, the better you'll get. And come around. Okay, so we'll go to seated position. We're going to knee cars and knee capsule players. So we'll start with the knee car. It doesn't matter which leg you start with, we want to take the same side arm, hooks under. So I'm hooking that arm under that leg, just get a good tight grip on it. We're going to take this arm, just hold here, and then we can go from this position, so left hand grabs right bicep, right hand comes over the top of the knee, or you can stay here, and then this hand will go there. It's up to you, so you're going to lean back just a little bit. If you want to use this hand, you can, just to direct the tibia in or out, or you can hook here, or you can go hands together. A lot of different options for you. Make sure that your femur, your upper leg does not move. You get all the rotation from the shin. Out, extend, come in, down. Out, up, in, down. Now stay in, up, out, down, in, up, out, and down. Here we're just going to do capsule cars. We'll go for that full flex position first, and we'll hold here. If you want to use your hand, if you're new to this type of stuff, you can go heel down, use your hand, and we're just going to rotate there. As we've done this before, you can go here, come up just a little bit, and then we can rotate in and out. Like a 3 stretch. Go in and out. One more time. In, out. From there, up, in, out, in, out, in, out. You notice that your foot's moving a lot, your shin's not getting a whole lot of motion. So grab that shin and then just use your hand just to guide it both directions. Your foot will move because your foot is off course to catch your ankle and your tibia, but if we don't want to just get foot motion, we want to get full tibia rotating in and out. Last one for this leg, we're going to come up, almost extended, not fully extended. If you fully extend, you won't be able to rotate the tibia. So we're thinking 135 degrees, 140, I'm not as good as geometry as used to be, so I'm just going to go out, in, out, in, out, in. Very good, and we'll switch. Rotate other side. Right on the right leg. Hold here, whatever's most comfortable for you. Rotate out, extend, rotate in, and down. Rotate out, extend, in, down, stay in, up, out, down, in, up, out, and down. From there, we'll go capsule cars. We got 3 each direction. We go heel down, or you can stay heel up. Internally rotate, use the hand in here. Externally rotate. Internally rotate. So you want to watch that spine of your tibia rotating out. Rotate in. Rotate out. Come back to about 90. Out. In. Out. In. Out. Last one. And in. Now just a little bit more. So again, if you fully extend your knee, you can't rotate that tibia, right? So you want to be just beyond, just before lockout. The more you extend your knee, the harder it's going to be. So you'll notice you don't get as much rotation. The higher up you come, the more you extend that knee. That's okay. It's normal. Just try to focus on that motion. Rotate tibia. Rotate tibia. From there, let's go into our toe cars. So you can from sitting, you can from standing. If you want to make it harder, you can go to a half minute position. The more you flex your ankles, the harder it's going to be. If you want to make it really hard, you go into your squat position. So from there, balls of your toes stay down. Spread those toes, lift them, try to extend those toes. It's called abduct the toes, trying to spread them as far as you can, and then just come down. 4 toes come down. Big toe goes up. Big toe down. Big toe up. Big toe down. Last one. Big toe up. Big toe down. 4 big toes down. 4 toes up. 4 toes down. 4 toes up. 4 toes down. 4 toes up. 4 toes down. Lift all those toes. Big toe down. Big toe up. Big toe down. Big toe up. Big toe down. Big toe up. Last one. Piano key. Pinky toe. 4th toe. 3rd toe. 2nd toe. Big toe. 2 more. Lift those toes. Keep trying to spread them apart as far as you can. Pinky toe. 4th. 3rd. 2nd. 1st. Last one. Spread those toes. Reach them apart. Pinky toe. 4th toe. 3rd toe. 2nd toe. And big toe. Straighten that if you need to. We go right back to the tibia rotations. Now we're going to do what's called tibia hills and rails, but we're going to do some long duration hills and rails. So normally we do 10-second rail hills, 10-second max effort, and then we do a 15-second rail max effort. So what we're going to do is we're going to do 1 set tibial external, tibial internal, and we'll do 1 set tibial internal, external, but we're going to go for about 30 seconds each direction. So 30-second pails, 30-second rails. You can still build up the contraction, but because we're going for a longer duration, we're not going to do 100% of it. So we work up to about 50, 60, between 50 to 70% for the pails, and then for the rails, still do max effort, but again, it's 30 seconds, so the longer we do our set, the harder it's going to be, right? So just give everything you got, do your best, but just know that the focus of today is not a max effort per se. We just want to facilitate some internal and external rotation before we get into more of a linear motion, which would be our knee flexion work that we'll do. So here, left knee's bent, right leg's under, flex that ankle. Same setup as I did my cars, right? So left arm comes under, this hand can grab here, or you can grab here, grab the bicep. I'm going to work into my external rotation. So now what I'm going to do here is this right hand will grab the knee, left hand will grab outside of the foot. Okay? So with this hand here, I don't want to just grab, like, say, up by the toes. Think, hook your thumb kind of around what's called your medial malleolus, which is the kind of the bone that sticks out on your ankle here. Hook that thumb and go over it. So now we're not just pulling the foot, but we got more foot, ankle, and tibia, right? Because that's where the tibia will want to catch the ankle. So I can get a good grip around the lower shin. That's how I know I'm rotating that tibia. Okay, so here, and there, this hand will block the leg from going out, but this also this arm will block from going out. Rotate out as much as I can. Tibia faces out this direction. hang out here, stretch just for a little bit. So just while I stretch, I'll turn our tails rails, right? My tails, foot tries to rotate into the hand tries to pull that foot out. Rails, hand will stay still, foot will rotate out away from my hand. Okay? Like I said, we got 30-second tails, 30-second rails. We'll do internal, tails, rails, and then switch sides. Okay? Keep the body tight. Lock everything in place. And then start that tails contraction with the rotating foot in the hand in the foot. Start slow, and we'll build it up for about 30 seconds here. So 3, 4, 5, 6, 7, 8, 9, 10. So keep the contraction down right now. Let's go for another 20 seconds. 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, keep going, 8, 7, 6, 5, 4, 3, 2, 1. Now hands stay still, actively rotate rails contraction, pull away from that hand, keep going, keep going, keep going. You got 30 seconds here, keep going, 25, 4, 3, 2, 1, 20, keep squeezing, 19, 18, 17, keep trying to rotate more, keep trying to rotate more, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Whew. Very good. That was 1 minute, 30-second tails, 30-second rails. There's capsule cars. You, mine's already feeling like rotate a little bit better. Okay, so my internal. So the same thing, so now I'm gonna hook under. This hand will grab on the outside of this lateral malleolus. Pull not just foot. See as I go here, tibia rotates in. Take a breath. Breathe. Tails I'm trying to rotate out into my hand. Rails I'm trying to rotate away from my hand, not just at the foot, but at the whole tibia. Okay? Lock it in. Down and start that tails contraction down into that hand. 30 seconds here. Just keep going. Keep building it up to the first 10. It's maybe quite a different feeling. You've never done longer duration tails rails before. We're about 10 to 20 seconds, right? Like tails rails. So 30 seconds, maybe quite a different feeling. Let's go down to 15. Foot in the hand in the foot. Trying to rotate that foot out into external rotation. And tries to pull that foot into more internal rotation. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now rails trying to pull away from the hand. Hands can stay there. Or you can bring it up if you want to just kind of get some more feeling there, but we're actively trying to internally rotate more. If you want to hold there, you can. Just keep trying to take that foot in by actively rotating from the tibia. You keep the hand there, you keep the arm hooked under. Just make sure the femur does not move. Let's go for another 15 seconds. Keep going. Squeeze, feel everything up here. All this work in right now. Keep going. 5, 4, 3, 2, 1. And relax. Whew. Switch sides. Here, same thing, we'll go external first. Hand grabs not just the foot, but around the ankle, down the lower shin. Left hand grabs both lateral to medial pressure, just pulling slightly in, just to keep my leg from doing this, but also my right arm will give you some of that stability as well. Lock in the body. Keep everything still. Tails contraction. Foot drives into the hand, hand tries to pull that foot out more. Rails, foot tries to actively rotate away from the hand by actively rotating that tibia to rotate out. Okay? Breath. Lock in and tails contraction, rotate into that hand. For 30 seconds, we're not going to go max out for here. Just build it up. We're going to keep building up for the first 10 seconds. We'll build up to, like I said, about 50-70%. And we'll maintain that for just 20 seconds. Okay? And about 10, so another 20 seconds. Keep going, rotating into that hand, and rotates into that foot, Isometric contraction, you're pressing into one another. Try to do it from your end range of external rotation. You should as much as you can. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now rails actively rotate away. Hand stays there, heel stays down. Keep that heel there. Now actively try to get more external rotation. Again, as long as that femur stays still, you can remove the hands there. That helps you feel a better position, better connection. So kind of hold up here. Just keep trying to rotate tibia out. Tibia facing this way. 15, 14, 13, 12, 11, 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, and relax. Ankle crack there. Okay, let's do kills cars. Kills rails in my mind. Put them there. Some calcium cars. Do it out. Again, if you have any knee pain, if you have any knee injuries, especially ACL, the first thing that's going to condition you for future injury is lack of rotation. So the more rotation you get into that knee, just like every other joint, the more better you get at rotations, think internal external rotation, the better flexion and extension will be, because that's a sign of a healthy capsule of the actual joint itself, right? So the better my rotation gets, the better everything's gonna feel, okay? So we'll go internal rotation. So I'm going hooked. This hand grab the bicep if I want. This hand will grab around lateral medialis up here. Pull ankle, foot, shin if you want to do this. Kind of what I usually will do a lot of times is I'll take myself into internal rotation first. Kind of the capsule cars that we just did. Hold that there. And now use this hand to pull yourself in. Okay, so from here, pills, foot, ankle, shin, rotate out. Rails, try to rotate in. Okay? Take that in, lock it in, and start that pills contraction. 30 seconds here. Building it up for the first 10, and you're going to hold about 50 to 70%. And another 20 seconds, about 50%. Try 5 seconds. 6 seconds, 7, 8, 9, and let's go for 20 more seconds. Try to rotate into that hand. Hand tries to pull in more, so they're contracting into each other. Try to be at your end range of internal tibial rotation. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and rails, rotate more, and rotate in, rotate in, rotate in, take it, takes the hand. Keep it more. If you want to move the hand, you can. Just make sure the femur doesn't move. Everything else, try to get more internal rotation. You got another 20 seconds. Keep going. Keep going. Just long duration pills. One set, long duration rails, one set of each internal rotation. Quite new if you've never done this before. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Set 30-second pails, 30-second rails for each internal external rotation. If you've never done those longer duration, if you want to do them with lower intensity than you would, say, for like a max effort pails rail, which is 10 to 15 seconds. So work those in, especially like I said, if you're unfamiliar with knee rotation, doing longer duration, lower intensity is a great way to build what's called neural drive. So it's the connection between the brain and the receptors in the specific joint, which in this case would be the knee. Build those up, and then as you go more, now you can put more force, more energy into those, and then you can do higher, pails, rails at higher intensity. So that was the rotation. Now we're going to go into some flexion. Okay, so what we're going to do is we're just going to do some passive range holds for knee flexion. So you've done our pills and rails before, pills and rails is not easy. So we're going to do passive range holds, which may cause a hamstring cramp, but it's really just going to allow us to focus on knee flex. It's really a half knee position. So if you'd like, you can take the mat, if you're using one, hold it under you a couple times, so you're going to get a little bit more cushion. If you're at home, you can use a pillow, really anything, just to give yourself a little bit more cushion, just so the knee is not a limiting factor here. So what I'm going to do is I'm going to take this up. We got one set, so I'm going to try to not extend the lumbar spine. I'm going to tuck my tailbone. Ribs are down. One set, we got 5 5-second holds. I'm trying to pull up as high as I can. Squeeze squeeze my glute, actively contract that hamstring, release, hold, 5, 4, 3, 2, 1, back down. 4 more there. Tight, lock in, and hold, 5, 4, 3, 2, 2, back down. 3 more. Tuck the tailbone, squeeze the glute, squeeze the hamstring, 5, 4, 3, 2, 3, 2 more. Here we go. Tuck, squeeze that core, squeeze the abs, squeeze the glute, hold that hamstring, try to pull that heel up as close to your butt as you can, maintain that close, and release. 5, 4, 3, 2, 1, 4. Last one. Come up, squeeze, actively try to pull, heel the butt, track the glute, track the hamstring, squeeze and hold. 5, 4, 3, 2, 1. Ooh, that is tough. You did legs yesterday like I did. Let's switch. We got 5 on the other side. We'll finish with some toe cars. Okay, so from here, come back up, get tall. Try not to do a bunch of this, a little bit, maybe inevitable. That's what your body's used to. But really just trying to put the ribs down, core's engaged, keep this nice tight core position there. Try not to extend too much there. Get there, really focus that squeeze. The hamstring, which is really just knee flexion, right? So get set, lock in the body, ribs down, squeeze, actively try to pull the heel to the butt, squeeze that hamstring, and release. 5, 4, 3, 2, 1, 1. 4 more. Grab the ankle, grab the foot, ribs down, squeeze glute, hold, and release. 5, 4, 3, 2, 1, 2. Cramping here, that's okay. It just means your knee is not used to flexing and contracting from that short position before. That's okay. That just means we need more time, more attention, more focus, and work in that area. We got 3 more here. Ready? Lock in, or take a breath. Squeeze, hold, and release. 5, 4, 3, 2, 1. Oof. 2 more. We got toe cars and we're done. So go from there, squeeze the glute, squeeze the hamstring, pull that heel to the butt, and release. Hold. 5, 4, 3, 2, 1, 4. Last one. Last one here. Grab that foot, grab the ankle, pull as high as you can. Squeeze, tuck the tailbone, squeeze the glute, squeeze the hamstring, and release. Hold. 5, 4, 3, 2, 1, and down. Very good. So the knee flexion, passive rear shoulders. Okay, so last thing we got, we go standing toe cars. So we did the kneeling ones, or sorry, seated ones before. You want to go to kneeling, like I said, the more you flex your ankle, the harder it's going to be. You can try those, or you can go from the squat position. We're just going to go from standing here, so we're just there, hands on hips. Lift those toes, spread them, big toe up. All the toes down, 4 toes down, big toe up, big toe down, big toe up, big toe down, big toe up, big toe down, 4 toes up, 4 toes down, 4 toes up, 4 toes down, 4 toes up. Keep them up. Lift the big toe now. Big toe down, big toe up, big toe down, big toe up, big toe down, big toe up. Last one here, piano key, pinky toe, 4th toe, 3rd toe, 2nd toe, big toe. 2 more. Spread those toes. Really try to spread. Keep 3 points of contact. So ball of your pinky toe, ball of your big toe, and your heel down. Pinky toe, 4th toe, 3rd toe, 2nd toe, big toe. Last one. Lift and spread. Pinky, 4th, 3rd, 2nd, and big toe. I'm going to go tip toes. I always finish them that way. But that was it for today's 25-minute knee and toe focus control class. The toe cars. Just want to work those in because we always use more toe cars, more intrinsic foot strength we call it, and then we work on the called long duration fields of rest. So we don't go to 100%, we go about 50 to 70%. 30 seconds, you can even go up to a minute. We did internal and external rotation, because again, the better my joints can internally and externally rotate, right? So the more rotation I have, say at my knee, the better I will be able to flex and extend. So we just threw in some of the passive hold from the flexion. Those are tough. So those get cramps, that's okay. That just means called neurological infusion. It's a tight contraction area it's not just contracting into. So the more practice you get there, the stronger you'll get, the better those will get. So again, thanks for joining me to this 25-minute knee and toe focus Kinstretch class. I hope to see you at the next one.